So, you want to understand more about functional medicine for autism? Well, the best way to explain what functional medicine for autism is would be to run through the way the functional medicine diagnosis works. And then I'll give you examples from science and research behind the thinking. And then I'll show you as well some of the test results that I've had from people who've been through this process already. So, the best place to start really is with the charge study. And this was the inspiration, certainly for me, using functional medicine for autism. And then once we've looked at the charge study, we'll need to go through the 7 body systems and how an imbalance in one system can have a knock-on effect on the others. This approach is where functional medicine really differs completely from conventional medicine, which of course is geared towards treating symptoms rather than systems. And then we'll also talk about genetic differences that are common in people with autism and how that can impact body systems as well. And most importantly of all, of course, we'll look at what we can do naturally to mitigate any of the less desirable effects of autism or developmental delay. So the CHARGE study began in 2002, but then it was published in 2006, and it stands for Childhood Autism Risk from Genetics and the Environment. It's linked to the University of California, Davis Center for Children's Environmental Health. And it does appear to be the first large-scale population-based epidemiologic investigation focusing primarily on environmental exposure, as well as the interaction with the children's genes as an underlying cause for autism. For this study, they used over 1,000 families, and the children were aged between 24 months and 60 months old. They decided to conduct the study because there'd been several other studies before that showed that, quote, gene penetrance and expression may be influenced, in some cases strongly, by the prenatal and early postnatal environmental milieu. And then other studies suggested that xenobiotic chemicals or maybe viruses may be linked, but there was an inadequate, rigorous methodology to account for the increase in the prevalence of autism that has been seen over the last couple of decades. So, in the words of the authors, the study will address a wide spectrum of chemical and biologic exposures, susceptibility factors, and their interactions. Phenotypic variation among children with autism will be explored, as will similarities and differences with developmental delay. The researchers found that, and I quote, evidence for genetic causes is strong, yet concordance in monozygotic twins suggests that a minimum of 40% of autism cases are likely to have an environmental cause. That's 40%. So what the study found by 2006 is that, first of all, no single factor accounts for all autism cases. They also found that there's an association between exposure to traffic-related air pollution and the risk of autism. They identified that there's no single event or exposure that could be responsible for the rapid increase in diagnoses in recent decades. And they also saw that gastrointestinal problems are significantly more common in children with autism than children without autism. And finally, that each child's path to altered brain development may be different. So with that in mind, it follows that there's no one-size-fits-all solution that will help all children with their symptoms of developmental delay or autism. And that's why I'm so excited about what functional medicine has to offer. And it's the basis for my trademarked D.A.R.I.N.G approach to autism. So now I'll explain the basics of functional medicine, but I'm going to use examples that will show you what this means for somebody with autism specifically, using research papers that's backed up then with lab results that I've seen from the families and the children that I've worked with. It follows that there's no one size fits all that will help all children with their symptoms of developmental delay or autism. Gastrointestinal upset or imbalances are pretty much a given in children with autism. And this is due to a variety of factors, but the end result is not only chronic constipation or diarrhea, but abdominal pain and quite often smelly wind. But it's also been linked to behavioral issues that are commonly associated with autism spectrum disorders. And according to this study, quote, children with autism spectrum disorders, or ASDs, can benefit from the adaptation of a general pediatric guidelines for the diagnostic evaluation of abdominal pain, chronic constipation, and gastroesophageal reflux disease. Children with ASDs who have gastrointestinal disorders may present with behavioral manifestations. End quote. So what this means is that if you've noticed that your child has irregular bowel habits, or maybe if they're showing signs of acid reflux or retching or vomiting, they have stomachache, then it's definitely worth having a gut function test done. This is a simple stool test that you can do at home. And if you're in the UK, Europe, or United Emirates, I can actually have the kits sent out to you at home. If you're not, if you're outside of those regions, then please get in touch and I will tell you who can do it locally for you. Typically, I see nutritional deficiencies in children with autism, partially due to a limited palate, but also due to a genetic inability to digest certain nutrients. In the top example here, you can see that it's a list of the key antioxidants that the body really needs to detoxify the body properly. And so all bar one of them in this instance are either in the moderate to high nutritional need. The second test shows a very significant deficiency of B vitamins, which are absolutely essential for neurotransmitters that govern mood and behavior. And they also have an impact on focus and attention, as well as interaction with the external world. And then on the right-hand side, you can see the laboratory recommendations based on the results for that particular test, but they do not factor in the nutritional deficiencies that may be needed to compensate for any genetic imbalance. So that would be assessed during a personalized functional medicine assessment. But it still gives you a very good indication of which nutrients are lacking, and then you can see what the role of those nutrients is in the body. Then we move on to defense and repair. So this is all about infections, bacteria, viruses, chronic inflammatory diseases, and anything that affects your immune system. Now, there's a lot of evidence around this that points to an altered immune dysfunction in autism spectrum disorders that directly impact some or all of the neurological processes. Extensive alterations in immune function have now been described in both children and adults with ASD, including ongoing inflammation in brain specimens, elevated pro-inflammatory cytokines. And then it goes on to say, furthermore, these dysfunctional immune responses are associated with increased impairments in behaviors characteristic of core features of ASD. In particular, deficits in social interactions and communication. They also say that this accumulating evidence suggests that immune processes play a key role in the pathophysiology of autism spectrum disorders. So here you can see this is just one sample report on the body systems, and in the middle you can see a score of 8. and that's in red under the need for inflammation support. So this is the kind of result I get back in somebody who has got systemic inflammation that's likely impacting the autism. And in fact, in the column on the right, you can see that the levels of toxic exposure to lead and cadmium are elevated. So this indicates both increased levels of exposure and decreased levels of the body's ability to detoxify from that exposure, which together have triggered an inflammatory response that is known to hinder neurotransmitters and lead to increased symptoms of autism. Then we move on to environmental toxins. So these are two glyphosate profiles, and they're both from children. One's aged 4 and one is aged 7. As you can see, one's in the 100th percentile and the other is in the 75th percentile of glyphosate contamination, respectively. The test underneath that is measuring for toxic compounds, and in this instance, the child is in the 90th percentile for contamination with plastics. Now we'll move on to energy, the energy system of the body. And this is about cellular energy and mitochondrial function. And it's also about your get up and go, your general energy levels throughout the day. So energy production is an area that has been researched quite extensively with regard to autism. But I've chosen this case study on a 4-year-old boy because it reflects a lot of what I see in my clinical practice. Energy in this instance means the body's ability to generate energy at a cellular level. It doesn't refer to you get up and go here in this case. The energy powerhouse in a cell is called the mitochondria, and a dysfunction in the mitochondria is actually really common in autism. The title just means that there was an improvement in the symptoms of regressive autism. And this child had a genetic deficiency that prevented him from synthesizing carnitine. And the study said, and again, I'm going to quote it here, disorders of carnitine biosynthesis have recently been associated with neurodevelopmental syndromes such as autism spectrum disorder, ASD. A 4-year-old male with autism and 2 episodes of neurodevelopmental regression was identified to have a mutation in the TMLHE gene, which encodes the first enzyme in the carnitine biosynthesis pathway, and concurrent carnitine deficiency. Following carnitine supplementation, the little boy's regression ended and he started regaining developmental milestones. And this case report suggests that deficits in carnitine biosynthesis may be responsible for some cases of regression in individuals with autism spectrum disorders, and that testing for the respective biochemical pathway should be considered. End quote. Okay, so all that means, in fact, is that if there's a genetic abnormality that's most likely triggering the autism symptoms, but if we can compensate for that genetic defect by supplementing the diet with carnitine, then we may be able to help your child regain his or her developmental milestones. I should emphasize at this point that this is just one case study done on a 4-year-old boy, but supplementation with carnitine is very easy and it's also present in many foods. So if your child has a restricted diet, it could mean that firstly, they're not ingesting enough of the carnitine or the nutrients that they need. And secondly, they may need more than your average child to compensate for the genetic deficiencies. But both of these aspects are readily treatable with functional medicine and with maybe a mitochondrial support diet, for example. However, I would also add that it's not one single gene that's responsible for autism, and different genes affect different nutrients. And that's why functional testing is particularly important to personalize the treatment. But the purpose of this particular bit of research, really, of showing you this, is to illustrate that functional testing to identify which nutrients are lacking in your child's diet can potentially make a very significant difference to the outcomes. Okay, let's now move on to biotransformation and elimination. This is basically your body's detoxification process. Um, it's a metabolic process. So when things break down, do they break down properly, and can you eliminate the waste products? It's facilitated by enzymes that then convert the toxins into something either less toxic or something that's more easily moved out by the detoxification organs. You may have been tested for toxins such as mercury, bacterial or viral infections. That's where you may have come across this before. But you can also think about disorders relating to the major detoxification organs and whether you're showing any symptoms of that. So those organs are the skin, the lungs, the liver, the kidney, the small and the large intestine. So any ailment that affects those systems is also going to be related to detoxification issues. Okay, here's another quotation for you. A personalized diet coupled with probiotic administration, especially those that absorb lactobacillus. Oh, hang on. Regardless of comparable diet regimes and consequently comparable levels of exposure, average values in autism group are always lower, suggesting altered biotransformation and metabolism of the toxins that might not follow the traditional route of exposure. Okay, let's move on to transport. So, this is to do with the health of your lymphatic and cardiovascular system. You might think about conditions like high blood pressure, low blood pressure, high cholesterol, and lymphedema as well. In terms of autism, I'm not going to go into a huge amount of detail on the transport system because the science is very, very exciting, but also very, very complicated. But basically, it appears quite recently that there's a connection between lymphatic drainage, cerebrospinal fluid, and a new type of fluid called extraaxial cerebrospinal fluid that appears to travel around the brain. So the idea is that maybe that could be causing additional pressure on the nerves and the synapses that's giving rise to symptoms of autism. But here's a quotation from this piece. The newly discovered meningeal lymphatic system might help explaining how immunological dysfunctions and peripheral chronic infection or inflammation may affect the meninges and consequently brain development. The observations of increased EAF, that's the fluid I just mentioned, in the autism population, with these new observations of a central lymphatic system connected to cervical lymph nodes, should direct more attention to the role of meningeal lymphatics in the pathogenesis of ASD. The pathogenesis of it means how the condition develops, the pathway that it follows. So that's all very new and very exciting, but basically it means we need a good transport system with good lymphatic drainage. So now we'll move on to communication, and this is all about the health of your endocrine system. That's the system that regulates the internal environment by secreting chemical regulators, hormones, and neurotransmitters. Psychological disorders that may seem chemical and hormone health, such as cortisol, insulin, estrogen, progesterone, testosterone, all involve this system. Okay, finally, we'll look at structural integrity. This refers to obviously your musculoskeletal condition like muscle pain, joint pain, arthritis, osteoporosis, but it also talks about structural integrity of your cells and the physical structures inside your body. So, in the case of autism, it's cellular structural integrity that's the primary concern. Mitochondrial dysfunction is very, very common, as we discussed in the section about energy. But now I'm going to discuss something here that covers the gut-brain barrier because it's the cellular structures that are failing to keep the toxins at bay and protect the brain in the normal way. So again, I'm going to quote the authors from this systematic review. The results of the present systematic review demonstrate an interrelation between Clostridium bacteria colonization of the intestinal tract and autism. Finally, we also hypothesize about Finally, we also hypothesize about how environmental glyphosate, that's the GLY, levels may deleteriously influence the gut-brain axis by boosting the growth of Clostridium bacteria in autistic toddlers. And here's the evidence from the functional tests that I've conducted in children. You can see that there are different species of the Clostridium bacteria. So in the first instance, you can see the biomarker HPHPA is high, but in the second instance, it's 4-cresol that's elevated. These individual biomarkers give me specific information about the symptoms experienced by your child and obviously the pathogenesis of the developmental delay. But do you remember the glyphosate slides that I showed you where one child was in the 75th percentile for glyphosate toxicity and the other one was in the 100th percentile? Well, these results are from the same two children, which confirms the results or the findings of the study. So to summarize what we've discussed, I trust that you can see that each case is individual and that the functional tests can help significantly in getting to the root cause of your child's autistic symptoms or of his or her developmental delay. At Barefoot Medicine, my motto is roots, resilience, radiance. I really believe in getting to the root cause of any health condition. And then we can help, in this case, your child, to build resilience and then to blossom so that they can reach their full potential. And when we reach our full potential, that's when we radiate. So now that you've got a better understanding of the principles of functional medicine, I'd like to introduce you a little bit more to my I'd like to introduce you a little bit more to the trademarked D.A.R.I.N.G approach to healthcare. It's not just an acronym. It's a new paradigm in healthcare that's designed to tackle the chronic health problems that we as a society are facing. Conventional medicine is nothing short of miraculous when it comes to saving lives, but it's designed to suppress symptoms rather than to actually make you healthy from the roots up. So this is why maybe the title of the presentation should be why your health is so much more than the absence of illness. And in the case of autism, we certainly want to help people to be as healthy as they can possibly be. So the D.A.R.I.N.G approach to healthcare is really about taking back control of your own health. So let's drill down into this a little bit more. The D stands for discover, and that refers to the functional medicine matrix that we spoke about, where the body systems are part of that matrix. Then the A stands for analyze, because I believe that test, don't guess is a much better way to save time and eventually, ultimately, money in the long run. Then the R is for report, so we get the scientific reports back from the state-of-the-art tests. And then I is so that we can integrate the findings of that report into your daily life in a realistic and achievable way so that you can manage it and not be overwhelmed by it. Because sudden changes in habits just don't work for anybody. So be patient. This does take time. And if you have a healthcare plan, then you'll always know that you're heading in the right direction. And then N is for nourish, and this refers to nourishing your body as well as your mind. And we achieve this using customizable meal plans, nutritional supplementation, as well as mindfulness and meditation practices. Finally, the G is for guide, and that refers to your plan for the future so that you know where and how to get help down the line if and when you need it. This may be, for example, by joining our online community, Nourishing Neurodiversity, or it could be regular catch-ups. It could be reaching out to charities or organizations that can help you. But it's going to be different for everybody, but there is help and support available for you. So there it is, your introduction to functional medicine for autism using the D.A.R.I.N.G approach to healthcare. I hope you found this daring approach to be something that's empowering and encouraging. Thank you very much for your time. And if you would like to reach out to me, my name is Simone Buna, and you could go to my website and book a call with me. So the website is www.barefootmedicine.co.uk, or you can email me at hello@barefootmedicine.co.uk. Thank you very much for your time. I hope you found it helpful.